Hi, everyone, and welcome to today's BioX Tech webinar. So 2 months ago, we learned about cardiac xenotransplantation with Dr. Muhyiddin, and last month, we learned about 3D bioprinted hearts with Dr. Bliley. This will be the third and final installment of our series on cardiac-related topics. Today, we are here to learn all about bioresorbable cardiac pacemakers with the inventor himself, Dr. Choi. We are so fortunate to be able to have him here today to discuss with us his exciting and groundbreaking work. I discussed with Dr. Choi, and we will take questions after the presentation. I'll be the moderator. You can either use the raise your hand feature in Zoom, and I will call on you to ask your question, or you can just type your question into the chat, and I will ask your question on your behalf. Now, I'll kick this off. I'm honored to introduce Dr. Choi. Dr. Choi obtained his BS and MS degrees from Yeon Sik Choi University, Korea, in material science and engineering. He spent 2011 to 2015 as a senior researcher in the Advanced Materials Development team at LG Korea, working on polymer nanocomposite for electronic devices. In 2019, he received a PhD in material science and metallurgy from the University of Cambridge, UK, with support from the Cambridge Trust Scholarship. Currently, he works under Professor John A. Rogers as an NIH K99 postdoctoral fellow in the Query Simpson Institute for Bioelectronics at Northwestern University, USA. In 2021, Dr. Choi received the Pathway to Independence Award from the NIH. He is also the recipient of the IIN Outstanding Research Award, the Baxter Young Investigator Award, the Regeneron Prize for Creative Innovation, the CSAR PhD Student Award, the ABTA Doctoral Researcher Award, 2 Best Paper, and 3 Best Poster Awards. Dr. Choi's works have received extensive global media coverage. One of his inventions, bioresorbable cardiac pacemaker, which we will be learning about today, is exhibited as a permanent collection at the Thackray Museum of Medicine in Leeds, UK. Dr. Choi, the floor is yours.
All right, cool. Thank you very much for your kind explanation and introduction. So let me share my screen first. I think you need to give me some minutes.
Let's see. Sorry about that.
No problem.
Let's see. There we go. That should work now.
All right. So, okay. Can you see my screen?
Yes.
Awesome. So, hello everyone. I'm Dr. Yeon Sik Choi. I'm really happy to meet all of you. I'm really excited to introduce my work in front of you because this is the maybe very first time I introduce my work in front of the high school student or some of middle school students. So I try my best to prepare my presentation with very straightforward words and try to reduce all the jargons, but there should be some jargons that is quite difficult to understand for you. Then please don't hesitate it. So please write it and just let me know. Then I'm happy to explain more about that. So today I'd like to talk about a fully implantable and transient cardiac pacemaker. Actually, I like to briefly introduce about myself. My background as she introduced. Actually, my background is material science. So although today's topic is related to the cardiac pacemaker, what I want to focus more on is some kind of materials related issues because, this is unusual type of medical devices. So of course, at the last part of this presentation, I will also introduce some progress as a pacemaking system. So let's get started. I'm not sure you've heard about the transient electronics. So transient electronics is kind of electronic systems that dissolve or physically disappear at program rate. So if you see this picture, then you can see some kind of resorption or disappearance of this device. So actually this is the electronic device, but when we spray the water, then because of the hydrolysis reaction, we can see the disappearance of the electronic devices. And my research topic is, we call that bioresorbable electronics, because if we use this concept of the transient electronics for our body as a medical implant, like some temporary diagnostic or some therapeutic implants, then we can make it as some bioelectronic systems that can be resolved by our body. So my main motivation is from the collaborative work with cardiologists at Northwestern University Hospital. When I discuss about some possible application of my research, bioresorbable electronics, they suggested me to develop a cardiac pacemaker. I believe you're very familiar with the concept of the cardiac pacemaker and the electronic device we implant inside our body and live forever. Then this device can support our heart function, right? But what I focused on is a little bit different type of pacemaker. We call that the temporary cardiac pacemaker. Actually, the temporary cardiac pacemaker is the electronic device for the patient after the heart surgery, because during their recovery period, they need additional support for their heart function, but they don't need to live forever with those kind of devices, because they only need to use it only around 7 to 10 days, and after that they can just remove it. So this is the reason why we call that temporary cardiac pacemaker. And like this photo, some neonatal or pediatric patient with congenital heart disease, they also need to use this type of temporary cardiac pacemakers. But the problem there are two serious issues in the conventional temporary pacemaker. The first issue is related to the percutaneous electrode. Actually, this schematic shows some connection between the external generator and the heart. So this is the external generator, and it is connected to the heart directly using the percutaneous lead. So because of this kind of direct connection between the external generator and to the heart, first of all the patient cannot move freely because of this kind of connection. And they have to be hospitalized. And the serious issue, one of the most serious issues is this percutaneous site. So this penetration site would be the nidus for infection. As a result, doctors recommend to remove this device within a month, because this part can generate some kind of infection or inflammation, and they need to be hospitalized and inject some more antibiotics to prevent those kind of some risk. And the other serious issue is their removal surgery. So the usual way to remove this device is just pull out the external generator from the outside of our body. It is hard to believe, but it is true. So in this 21st century, so this is not a very scientific method, but this is a usual way. Then during the removal surgery, there should be some tension on the electrode, and sometimes this electrode can be broken. Then they need to do additional open chest surgery to remove all the remaining wires inside the patient body. And the other problem is, in the case of the neonatal or pediatric patient, as their heart tissue is much more fragile than the adult cases. Then during the removal surgery, because of the fibrotic tissue growth, their heart tissue can be, there would be some kind of perforation of the heart. I don't want to imagine those kind of situations. Then, what if we develop the wireless and bioresorbable pacemaker? First of all, if the device has a function of the wireless transfer, then we can solve the first problem because we can fully suture the wound. In other words, we can remove the percutaneous electrode and we can operate the device wirelessly, from the external transmission coil. So like this photo, like this schematic, we can transfer some energy wirelessly from the outside of our body to the implantable devices. And if all the constituent material of this device is bioresorbable, in other words, if all the materials can be absorbed inside our body without any some adverse effect to our body or health condition, then we don't need to worry about any risk related to the removal surgery. Because after the treatment period, this device can be disappeared naturally. Then as a material scientist, I have to think about three important scientific questions. So first one is related to the materials. Second one is related to the fabrication techniques. And third one is the system level embodiment. First of all, let's think about the materials issue. I'm not sure you're familiar with the electronic devices and the materials for the electronic devices. Actually, what we need to consider is three different types of materials. We call that electronic material. The first one is insulator. Second one is semiconductor. Third one is conductor. Actually, the insulator is like some polymer material. So if you contact some electrode, on this type of some PET, then there should be no some electrical connection or you cannot measure any some electrical conductivity. That is because of some very large band gap. You don't need to know about the band gap at this moment. So if you're not familiar with it, then you don't need to worry about it. So anyway, because of those kind of some materials characteristics, the insulators like some polymers or some wood or some papers, it is not electrically conductive. And there are some conductors like a metal. So the reason why the metal itself is conductor is because of the many free electrons in some metal surface. So if you contact two electrodes, then you can measure some electrical conductivity between these two poles. And there is some different type of semiconducting material that is semiconductors. So semiconductors is, as you may know, it is one of the most important materials in this century because, it is one of the key materials to develop some electronic devices. So, the semiconductor material is kind of materials that we can change the electrical conductivity. So if we do not apply any voltage or if we do not do something, then the material itself acts like an insulator. However, if we apply the voltage or some shine the light, do kind of something, then, we can excite the electrons and make them conductive, like a conductor. So this is the reason why we call the semiconductor. All right, so anyway, if we want to develop the bioresorbable electronic devices, then we have to find bioresorbable insulator, bioresorbable semiconductor, bioresorbable conductors. Actually, that is not an easy task. Then for example, what kind of metals can we use for the bioresorbable devices? Have you heard about some water-soluble metals? Marco, have you heard about that any?
I have not in particular, no.
Yeah, I'm sorry because I can see your face. Thank you very much to turn on your camera. Yeah, I'm really happy to this kind of discussion. Actually, maybe you're not very familiar with some water-soluble conductors. So our main idea is from the vitamin pills. Actually, when you see the backside of the vitamin pills, then interestingly, you can find many some familiar names of the metals, including some iron, magnesium, zinc, molybdenum, and it means that it is really, really important. It means that first of all, those kind of metals are biocompatible. Second, those kind of metals are water soluble because we usually take it every single day. And the third one is the material itself and their byproduct are beneficial for our health. It means that we can use those kind of materials, especially those kind of materials for the development of bioresorbable devices. Then, the molybdenum, magnesium, can they dissolve in the water? Yes. So that is what we've done at the first time. So this is quite complicated, but it's quite simple. When you immerse the metal, for example, some molybdenum or magnesium, so this is the molybdenum in the water, then, first of all, you can see some kind of oxide formation on the surface of it. So this is the molybdenum itself, and this is the formed molybdenum oxide. But, if you immerse it and as a function of time, then you can see the thickness reduction as a function of time. It means that this material itself is definitely bioresorbable or water soluble. And we can also measure the electrical conductivity because this is the metal itself. Then what kind of semiconducting materials we can use? Actually, if you see there's some supplement factor of the vitamins, then you can also find the name of the semiconductor. That is silicon. Actually, the silicon oxide is kind of like a glass, right? So you cannot imagine that those kind of glasses can be water soluble, but it is water soluble. So when we make it very thin, then we can also see the thickness reduction. And when we if we immerse it in the water, then we can also see the thickness reduction as a function of time in the water because of the reaction with the water molecule. So for example, this one shows some lattice structure of the silicon, and this one is some water molecules, and this is the simulation result, but you can see some kind of breakage of the silicon bonding because of the reaction with the water. So it means that we can also use the silicon as a semiconducting materials for bioresorbable devices. And the last one is insulating material. Actually, maybe you're familiar with some bioresorbable polymers because, we usually use some suturing thread, bioresorbable suturing thread. So there are many different type of bioresorbable polymer materials. So my colleagues did develop some prototype, we call the transient electronic devices. So this is the prototype device. It includes some inductor, capacitor, transistor, some resistor, diode. So all of those are some electronic component to generate some electronic performance. And when we compare some constituent material and the amount of the materials in these electronic devices relative to vitamin, we confirm that the amount of the magnesium is much smaller, less than some magnesium amount in the vitamin and silicon as well, because we make it very thin film, so with only around some few hundred nanometer or some few micrometer. So if you just weight it, then it is really, really small amount. All right, so we solved the first issue, some material selection. But when we implant this device inside the animal's body, we found that there is additional issue that is related to the stability. So we call it in vivo stability. We found that when we implant those kind of devices, then there is some kind of device breakage because of the low elastic limit. In other words, even though animal's body is soft and there is some kind of dynamic motion, but this device itself is not very soft or stretchable or flexible. As a result, it can be broken very easily. And the other problem is the water penetration. Actually, because we select all some bioresorbable or biocompatible or water soluble materials, it means that the materials or device can be some broken electrically, some broken very easily. And the other problem is interfacial adhesion. So, we usually use some kind of encapsulation materials to build the electronic devices. However, the encapsulation, the bioresorbable encapsulation material, especially the bioresorbable polymer we use, it does not have a very good interfacial adhesion. As a result, when we implant the device in the animal's body, then some biofluid, like some blood, can penetrate and some damage the electronic circuit. Then the problem is, this device can survive only around 1 day. It means that after 1 day, this device is not working anymore. But think about it. If you really want to use it as a cardiac pacemaker, even though it is this temporary pacemaker, we have to guarantee at least 30 days of what is that? 30 days of longevity. It's not very long, but this medical device have to be very reliable up to 8 months of some functional lifetime. Then how can I solve this problem? Actually, I try to check all the some materials, existing materials we can use. So actually, for the some encapsulation, we usually use some polymer materials. So this is all the list of the some bioresorbable polymer, but they have very low elastic limit, so they do not have the stretchability, and their adhesion is quite poor. This is the name of some polymer, bioresorbable polymer materials. Of course, there are some bioresorbable elastomers, but they still do not have a good adhesion property. So when we think about some adhesion of the polymer materials, of course, there are some polymers with a good adhesion property. For example, when you think about some kind of epoxy, then for some bonding, of course, those kind of materials have a good adhesion property, but their problem is they're not degradable. That is the problem. So my idea was to develop the bioresorbable elastomer with strong adhesion based on the stimuli responsive reaction. So we call that the dynamic covalent bond. If you know the covalent bond, if you heard about that, then relative to other bonding, the covalent bond is known as the strongest bonding and is kind of the permanent bonding. However, if we know some chemical reaction and the thermodynamics, then we can make it reversible, even though it is very strong. So let me skip some details of the thermodynamics, but this part shows some characteristics of the polymer with the dynamic covalent bonding. For example, there is type of some polymers that we call the thermoplastic, like some PET. The thermoplastic, then we can easily change the shape of this kind of polymer by just increasing the temperature, right? Because they do not have some kind of cross-linking. So, this is the way to make this kind of PET bottle. But, there is some different type of the polymer we call the thermoset. So like a epoxy or some, where's that? Some flame resistive materials. In that case, because of the cross-linking across the chains, their shape is not changed even at the high temperature. But if the polymer has the dynamic covalent polymers, dynamic covalent bonding, then we can make it like some thermoset, first of all, because they have a strong covalent bond as a cross-linker. And it is it can also act like a thermoplastic, because at certain temperature we can change the direction of the covalent bonding. So to design those type of polymer and to make it bioresorbable, I use some ester retin bond, and to achieve the interfacial adhesion, I used some dynamic covalent reaction. So this is the material I developed. So let me show you some interfacial adhesion behavior. So it is quite easy to fabricate the device, if you use this material. For example, if there is some inorganic electronic component, then just prepare two polymer materials. We call that BDCPU, Bioresorbable Dynamic Covalent Polyurethane. Then just prepare two BDCPU and place the electronic component and just do the hot press. Then, because of the dynamic covalent reaction, we can form a new covalent bonding between the chains, and we can achieve very strong adhesion between the encapsulation materials. As a result, first of all, because this is the encapsulation material, we can achieve very good water barrier property, even though it is bioresorbable material. And, we can also achieve a bioresorbability based on the hydrolysis reaction. In other words, this polymer chain contains the ester bond, and this bond can be broken by some water. So, we can make it bioresorbable. And, the most important thing is this material and their byproduct is biocompatible. All right. Then the next question, we need to think about the fabrication issue. Actually, what people try to do is just to fabricate the 100% inorganic. So inorganic means some rigid material like a glass or some like a stone. So some people try to bioresorbable device based on the 100% rigid material. The advantage of this kind of system is they can show very good high performance, good electronic performance. But those kind of material or devices not very stable inside the animal's body, because think about it. If you implant some kind of glass slide inside your body, then if that glass slide is broken, then their fragment would be quite dangerous for the soft tissues, right? And some research groups try to develop some 100% organic. Organic means 100% soft and plastic or some like material. So it is stretchable, flexible, very soft. So it is really good. So it is very stable inside our body. But the problem is their electronic performance is not very reliable. So because there is no very well developed some semiconductor materials or some conducting materials. So my idea was to develop some hybrid structure, organic inorganic hybrid structure. In other words, for some electronic circuit, just use very high performance inorganic materials like some silicon or magnesium, something like that. And for some encapsulation material, I can select some very soft materials like some polymers or some wax, something like that. Then the problem is how can we fabricate it? Actually, the conventional fabrication method, we usually use photolithographic process or some additive manufacturing process like some 3D printing. I heard that you took the classes last week or last month about some 3D printing. What's that? Some heart or hard tissues. Yeah, but the problem is we cannot use those kind of some conventional fabrication technology because of the limitation of the material itself. Actually, this kind of fabrication techniques can develop some miniaturized devices or some multi-layer structure. It is definitely possible, but because this material have to be bioresorbable, all the constituent materials should be water soluble, but this kind of process have to use some water or some liquid, then it can damage our material. And the other problem is rate of degradation differences. So let me explain it more. The rate of degradation difference means all the material have their intrinsic rate of degradation. For example, in the case of the silicon nanomembrane, so it means that very thin silicon layer, semiconducting layer, their rate of degradation is 2.9 nanometer per day. It is really, really slow. But in the case of the magnesium metal as a conductor, its degradation rate is really, really fast. And because this is the intrinsic character, so we cannot change it. then it means that if we want to achieve some long-term stability up to 8 months of the device, then, I mean, based on very simple calculation, we have to use the silicon nanomembrane with 90 nanometer, but we have to use the magnesium with around 210 micrometer. So there is a huge height or thickness difference. And this kind of thickness difference can occur, the difference of the energy release rate. So energy release, the physical meaning of the energy release rate is the propensity to crack to form when they attach to the dissimilar material. In other words, in the case of the silicon nanomembrane, the reason why we can use it, even though it is very thin, when we attach it to for example, some polymer substrate, it can maintain their shape, very easily because of their very low energy release rate. In other words, they can be stretchable when we put it on the, on the polymer layer. But in the case of the magnesium, because their energy release rate is quite high, when we attach it on the polymer layers, then, and if we make it flexible, then it can be broken very easily. So instead of the conventional fabrication technique to solve those kind of issues, I developed a new fabrication method. We call the adhesion supported laser ablation method. So simply, it is some kind of method to use the adhesion property of the material I developed, the bioresorbable DCPU. Then the advantage of this material is we can also achieve very strong adhesion with some dissimilar material, like we can achieve a strong bonding between the polymer, bioresorbable polymer, and bioresorbable metal. Then why we have to achieve that kind of strong adhesion between the metal and polymer? That is because it is related to the fabrication process. Actually, if we attach the bioresorbable metal or bioresorbable semiconductors on some encapsulation material, then we can use the laser ablation technique. So it is kind of laser cutting method. But because of some support of the adhesion layer, we can achieve very high resolution pattern without using any liquid. And the other advantage of this fabrication technique is we can easily achieve a perfectly aligned structure. So as you can see here, there is additional second layer on the top of the first layer, but this material itself is transparent. As a result, we can easily align the top and second layer. So there is some additional coil on the top of this bottom coil. And the last advantage of this technique is we can achieve almost perfect encapsulation by using the covalent bonding. Then what is the purpose of this kind of coil? Actually, now we move on to the system level embodiment. The purpose to develop this kind of coil based on the laser ablation technique is to realize the wireless energy communication system. Actually, this wireless energy communication system, the basic mechanism is really similar with some kind of wireless charger for your mobile. So in that case, this resonance frequency is quite important, but that resonance frequency is a function of the alignment and the function of the resolution of the coil. So it means that if we use very high resolution fabrication technique, then we can achieve high performance receiver, wireless energy receiver coil. And based on that fabrication technique, we can also fabricate the pin diode. Then by combining these two components, we can realize the wireless energy transfer based on the inductive coupling mechanism. So simply, we can send some AC signal from the external power source, and this device, especially this part, can receive the AC signal, and the pin diode can rectify that AC signal to DC signal, because we need to use the DC signal to pace the heart. All right. So based on that, we can also achieve the stretchable devices. So because the polymer material is stretchable, and we can also make some serpentine structure of the inorganic component, then the device itself is, as you can see here, stretchable, twistable, and bendable. So I mean, because of this mechanical stretchability, now we can safely implant those kind of devices inside the animal's or human's body. All right, so based on those kind of some materials selection, materials development, and the fabrication technique, I prepared three different, design of the electronic device. We call this some pacemaker. And yeah, now I'm going to show you some kind of some animal surgery photos. So if you don't want to see that, then yeah, please be very careful. So this one shows some rodent, implantation surgery for the rodent model and canine model. So this is the heart of the rat, and this is the device. So we try to suture the electrode contact point to the surface of the heart, especially the right ventricle, epicardial pod, and this is the dog's heart. So when we test the in vivo function, in vivo performance of this device, then first of all, we confirm the reliability of this device, our some bioresorbable device. Reliability means our device can successfully pacing the rat, rabbit, canine, and human whole heart based on some wireless energy transfer technique. So let me show you some example. This is some energy transmission coil that is connected to the external generator, and this is the prototype device. So this is the part of some coil, and it is connected to the rat heart. So it shows the normal heart rhythm, but when we turn on the device, it goes to the pacing rhythm. You can see the vibration. But if we remove the transmission coil, it goes back to the normal heart rhythm. It shows that how the inductive coupling mechanism pace the rat heart. We also confirm the stability of this device. As I mentioned, the previous electronic component is not very stable, and because of their rigidity and because of their some poor interfacial adhesion behavior, we call the functional lifetime is only around 1 day. It means that after 1 day, the previous device cannot work anymore. But because of the mechanical stretchability and because of the hybrid structure, we confirm that this device now can survive and pace the heart more than 32 days. So it means that we can use it as some very reliable and stable medical devices. I confirm the efficacy, clinical efficacy of this device to treat the AV block. AV block means it is one of some heart disease. So it is kind of conduction block between the atrial and ventricle. So if there is this is the normal heart. So as you know, after the atrial compression of the atrial part, then because of some conduction of the electrical signal, this is the conduction of the electrical signal, then the ventricular muscles try to receive some blood and so just do the subsequent compression to for the flowing of the blood. But the AV block means there is some conduction block between some atrial part and the ventricular part. Then in that case, usually we need to see this kind of, so this part shows the normal heart rhythm. So this arrow indicates compression of the atrial, and this QRS complex indicates some compression of the ventricle part. But this part shows only this peak, and there is no QRS complex like this. It means that there is some kind of issue for the heart rhythm. So it is really critical heart disease. And the way to solve those kind of disease is to use the pacemaker. So instead of the conventional pacemaker, we try to use the device we developed. So when we pace the heart of the rat with the AV block, we can see that this pacemaker can successfully solve the AB block of the RAG. The last one, one of the most key defining feature of this system is bioresorption properties, right? So we confirm the bioresorbable behavior of this device by using the CT scan. So when we implant this device, then as a function of time, you can see the disappearance of this material. Of course, the time period between this part and this part is 1 month. So during 1 month, this device is working properly, but after that, this device can be disappeared naturally and fully resolved inside the RAG body. So you can also see the some shrinkage and the degradation and disappearance of the devices. The most important thing is there are safety issues, and we confirm their safety by using some blood chemistry results. So when we confirm some, for example, up to 1 week, 3 weeks, 5 weeks, 7 weeks after the implantation of the devices, we confirm that even though there is some kind of degradation or some implantation of the device, there is no any adverse effect to the health of the animals. All right, so now is summary. I developed a fully bioresorbable leadless. Leadless means wireless and battery-free. As you've seen, there is no any battery because we use the inductive coupling mechanism, and the fully bioresorbable leadless battery-free cardiac pacemaker. So with the wireless function and bioresorption, I hope and believe this device can improve the quality of the patient life, and I hope this device and technology can change and improve the quality of their patient life. Thank you very much.
Thank you. That was very interesting. So now we'll be answering a couple questions that you have. So feel free to put them in the chat, and if you would like to say it out loud, please raise your hand and you can just say it. Or if you just want to type it into the chat, I will ask it for you. So also, it's okay if you can put it as a direct message to me if you feel uncomfortable with other people seeing your question. So let's get started. Let's see. All right. So can you, let's see. Can you adjust how long it lasts using in the future? Can you adjust how long it lasts in the body using specific stimuli? For example, if you inhale or drink something, it will start to dissolve faster.
That's a good point. That's a good point. So, so the answer is yes, it's possible. There is 2 different ways to control what we call the functional lifetime, the lifetime of the device inside our body. So the first strategy is passive way, and the second one is active way. And what you mentioned is kind of active way. But let me start from the passive way. So at this moment, we can control the lifetime of the device by changing the thickness of the device or change some combination of the devices. And if we fabricate the device with the materials that can be react with some kind of external stimuli, as you mentioned. For example, some polymer materials can be degraded by some shining, some UV, or those kind of some high energy light, right? So if we use those kind of materials, then we can also make it active. In other words, before those kind of triggering event, we can make them very stable. And after the triggering event, we can accelerate the degradation. Yeah, that is a really good idea.
Great, thank you. Okay, Avery has asked, is there a specific event that caused or motivated you to create these pacemakers?
Yeah, that's really good question. Thank you very much. Thank you, Avery. So actually, when I joined this research group, actually my colleagues also researched about this topic, some bioresorbable devices or electronic devices. But what I really want to do is, when I saw their research topic, at the time my thought is it is it is really fancy, but it is just some proof of concept. In other words, it looks not very practical. But I want to develop very practical. In other words, I want to develop something that can change the life of the general people, right? So I try to meet some medical doctors, including some neurologists, cardiologists, and I try to find the proper application I can use my expertise. And I found that, of course, we can use this technology for many different type of some medical devices. For example, some nerve stimulation, brain stimulation, spinal cord stimulation. We can also use it. But the reason why I choose the pacemaker is I thought that it can be some it can this technology can be applied very directly, and this technology can solve very critical issues in some conventional devices. And this is the reason why many people want to know more about this technology, and some companies want to commercialize this device with them. Yeah, some pacemaker companies. Yeah, because of their practical value. Yeah.
Yes, thank you. Another question is it possible to deliver drugs via a temporary pacemaker?
Yes, of course it's possible. Yeah, it's really good idea as well. Actually, that is also one of my research topics. So I made some kind of drug reservoir, and I can connect it with the same receiver coil. Then, by applying some voltage, I can open the gate of the drug reservoir. So by those kind of technique, I can do both of the electrical stimulation and also release some drugs to do some therapeutic, some pharmaceutical treatment. So that is kind of some combinational treatment. So, and that is also a very interesting field of study. Yeah.
Thank you. And let's see. What data do you need to collect about the patient prior to pacemaker implantation to ensure its safety and efficacy?
Yeah, that's a good point. Actually, as I shown you, when you visit the hospital because of the heart issue, the first one you need to check we call the ECG signal, so electrocardiogram, and actually the shape of the ECG is quite we can see very typical ECG if you don't have some issues of your heart. But if there is some kind of heart disease or heart attack, then the shape of the ECG is definitely different. And depending on the difference of the ECG signals, sometimes you need to do some kind of surgery, like some laser ablation surgery would be okay. But sometimes if the doctor thought that those kind of some medical some medicine or some just one-time surgery cannot solve your heart issues, then you need additional support from some pacemaker, those kind of devices. Yeah.
Thank you. And Uma has a question for you.
Hi, thank you so much for your presentation. I was wondering if you have any advice for someone maybe our age who's interested in bioresorbable materials or pacemakers or something like that. If you have any advice on how we can pursue our passions.
That's all right. So actually this research field, the bioresorbable electronics, actually is quite new field of study, because but it is really emerging field. So, and I think one of the most important background is the material science and biomedical engineering. So if you want to study more about this field of study, then I'd like to recommend you to study more about some material science, and especially some electronic materials, because our main some application is focused on some electronic devices, and of course the biomedical some engineering would be a good some match for some to pursue this field of study, because if you have some ideas of some specific medical application, like as I mentioned, some brain issues, brain disease, or some spinal cord disease, then you can apply the knowledge of the bioresorbable electronics for those kind of medical applications. Yeah.
Thank you so much.
Welcome.
Thank you. And Marco has a question for you. Glad we're getting all these questions.
Hi. Thank you very much for the presentation. It was awesome. One thing I was wondering about is, could you use bioresorbable materials and devices to somehow help with vascular issues in the body?
Yeah, of course. That's really interesting idea. Of course, I mean, it depends on some type of vascular issues, but the advantage of this system is this is electronic system, and for example, if we make some bioresorbable pump or some bioresorbable valve, then we can easily control it, because we just need to connect it electrically, right? Because like we control the valve based on this electronic circuit. Of course, we have to develop a much more complicated circuit, but I believe we can solve some vascular issues as well. Yeah.
Thank you. And do we have another question that was in the chat? Let's see. How cost effective are bioresorbable pacemakers? Do you see their mass production coming anytime soon?
I hope so. I hope so. Actually, in terms of the cost effective, so if we just considering, I can say that it is definitely affordable relative to other temporary pacemaker, because first of all, considering the size of the device, then this bioresorbable device itself is much smaller. It means that if you just care about the price of the material itself, then it is much cheaper. But what I want to highlight is the function of this device. As I mentioned, one of the biggest advantage of this system is we can remove the extraction surgery. Then think about it. If you need to do the extraction surgery of the external some conventional temporary pacemaker, then you have to be hospitalized at least 3 days in the hospital, and the doctors have to do some surgery, right? Then it is really expensive, regardless of some price of the device itself. But if we remove the extraction surgery, it means that then just after the treatment, the patient can be discharged, right? Then they can save the money for the hospital, and they do not need to pay a lot of money for the doctors. I think this is the benefit of the system. Yeah.
Great, thank you. Let's see. Ooh, so can we use similar mechanisms as how electric eels generate electricity to power the pacemaker?
Electric eels. Actually, I'm not very familiar with some electrical some kind of shock mechanism of the electric eels, but as far as I know, there are some power generation mechanism is a little bit different with the mechanism what I'm using, and I think it is not easy. My answer is because for this kind of some devices, one of the most important thing is their reliability, because this is the heart related device. It means that if this device is not working properly, then people cannot live, right? But in the case of the electric eels, as far as I know, they can generate very high electrical voltage, but they cannot generate very high current level, and they cannot generate continuously. Then I think it is not easy to use it, but that is a good idea, because we can use it as some supportive energy source. So for example, if you have some bioresorbable batteries with some bioresorbable capacitors, then we just put some electric inspired energy generator, and even though it is not very periodic, we can generate some energy and store it to the bioresorbable battery and use those kind of some energy in the battery to operate the pacemaker. I think that is some possible way. Yeah.
Yes, thank you. And another question, let's see. Is it possible to use this pacemaker to augment or improve human function rather than just try and fix something that is not going too well?
Yeah, it's like some sci-fi. So I hope. So I think it's possible, especially instead of some heart function. I mean, what I want to study more is about some brain stimulation. I mean, I believe you heard about some Neuralink, right? So Elon Musk's company.
Yes.
And what they try to do is implant some device inside the brain and try to record the brain function or do some electrical stimulation to, for example, treat disease. But their goal is write some information to the brain as well based on the electrical stimulation. Then what if we use this bioresorbable electronic devices instead of this permanent devices? For example, think about it. I mean, this is usual way I explain the bioresorbable devices. So if you have iPhone or mobile, then after 1 or 2 years, you want to replace it to the newest version, right? Because it has much high performance computing system in there, right? Because of the progress of the technology development. But think about it. If you just use the permanent device and if you implant it inside your brain, then you cannot replace it, even though there is some kind of technology development, right? So, however, if you use the bioresorbable devices, then after 1 year, then before the fully degradation of devices, we can implant brand new and much high performance device inside our brain to improve the performance of our body or our knowledge. So this kind of things is the part what I'm also interested in. Yeah.
All right, thank you. Our time is almost up, so I will ask one last question and we'll wrap it up. So can you tell us about one of your favorite projects that you did other than the bioresorbable pacemaker, maybe when you were younger in high school, or anything else?
Yes, so when I was some private school student, what I tried to do is develop a car using some recycling materials, like some papers, some boxes. But now I realize that experience was really, really useful for me because, some people try to buy a new material or try to find some materials they can use directly. But, bioresorbable materials, as I mentioned, the main motivation is from the vitamins, right? It means that I think some approach or mechanism is exactly the same. At the time, instead of just buying some new car, I tried to make some car using some recycling materials. And now I try to develop the bioresorbable materials instead of developing new materials. I try to find some materials in our daily life, like some vitamin. Yeah. So this kind of approach is also, I believe, helpful for you to develop a new material or devices for in your near future. Yeah.
All right, thank you. And so thank you for spending time with us today. This was such a wonderful opportunity to learn about bioresorbable pacemakers with the inventor himself. So thank you very much. Do you have any concluding remarks for us, maybe?
Yeah, thank you very much for your time. And it was my great honor to, as I mentioned, give a presentation in front of you guys, especially very high passion high school and middle school students. And I hope you can pursue and stay more in this field of study, because there are so many things you can do, and there are so many exciting research projects you can do. So if you have any question, or if you want to know more about, the research field I'm doing right now, then yeah, please feel free to let me know. Just email me. Then I'm happy to discuss anything about with you. Yeah.
Okay, thank you everyone for coming, and this concludes our today's BioX Tech webinar. Bye everyone.